discuss cases today also, and we can discuss few remedies, few cases. I'll show you a case of cholesterol of that patient, before after. A very wonderful case of cholesterol, treated and cured with homeopathy medicine. Even the patient was surprised, the doctors were surprised. I'll show you the report if I have the report with me. So first, let us start with the question answer session, and whoever joins early, please start the question so that no time is wasted. So one question regarding, I had a case where the patient told, so I have a case of cholesterol. Basically, in the report, it is not visible properly, but I will try to show you the report. Good afternoon, Dr. Meera. So let us start the session. So there was one question. There was a question that after the operation, the patient developed calculus in the bladder. After the operation, the patient developed calculus, मतलब ऑपरेशन के बाद उसके ब्लैडर में पथरी हो गई थी. तो कौन सा दवाई देना चाहिए? Dr. Prabhu, welcome. Dr. Vishaka, welcome. So it is a very interesting question and a very interesting remedy also I suggested to the patient. After any operation, if the patient develops calculus in the bladder, normally you may think about Staphylococcus aureus or arnica or other remedies, but I have found a very, very important remedy. I just now cured 2 cases of calculus of bladder after the operation of umbilical hernia. Dr. Weber, hello. So I was just discussing that I had 2 cases of calculus in the bladder after the operation of umbilical hernia. I gave that patient directly calendula 0/5 potency, 0/5 calendula, and by the time it reached 0/7, the calculus came out. It's a very interesting remedy. Everybody should read the remedy. Don't only read calendula for just injuries and trauma and wounds and all. It has lot of other things also in its therapeutics. Do see calendula. So I gave that patient calendula 0/5, both patients the same remedy, calendula 0/5. By it reached 0.7 and the patient was cured. Remember one thing in calendula, it is a fantastic remedy. Everybody knows that. Rupture of muscles, rupture of tendons, lacerated wound during labor, wounds, penetrating articulation, everything calendula covers. But this also symptom of calendula, that calculus after operation in the bladder. And one more symptom of calendula, which I had told you before in my webinar. It is a very, very useful remedy in one conditions. If you can answer me that question, I told you before also of calendula. Anybody? Do you remember I had told you something about calendula in relation to one disease, and it has given me very good results when I use calendula in LM potency in those conditions. Anybody? Good afternoon, Dr. Sachdeva. So I was just asking, calendula, always remember calendula in one of the very, very interesting conditions, a difficult condition to suppuration. Yes, everybody knows that. But a condition which I told you, use calendula in cases of fistula in ano. It is a wonderful remedy. Discharge, yes, fistula, Dr. Vishaka. It's a wonderful remedy, and I have used that in lot many of conditions. One thing also, write down in your notes, calendula I have used as a very, very interesting remedy as an intercurrent for cancer. Write down. In many cases of cancer of breast, when there was ulceration in the breast, lot of pus discharge from the breast, that was debulking was done, and as an intercurrent remedy for cancer, calendula has given me very good results. One more thing about calendula, nowadays you'll get a lot of cases of diabetic foot, and when the foot starts appearing blackish, or the Doppler study shows that there is a deficient blood supply. If you give calendula, it can prevent gangrene. I have lots of cases. Of course, you don't wait for the gangrene to happen, but when there is threatening gangrene, calendula has given me very, very good results. So these are the very clinical indications I have used calendula. Do use in your practice, do use in your practice, because see, everything is not cut and paste. I cut Mathemedica from here, paste there and tell you, okay, it's good to learn Mathemedica, but clinical Mathemedica is calendula 200 in cancer breast. I have just given 200 potency, and do use that in your practice, do use that in your practice, and it will give you good results. So this is about calendula, a very, very interesting remedy. And if you also get hemorrhage from the extraction of tooth, a lot of people think about Staphylococcus millefolium, erigeron, but calendula. I had a case where the wisdom tooth was removed and there was a lot of hemorrhage bleeding. I just gave the patient, let me tell you, calendula mother tincture to apply on that wound, and it gave me very good results within 2 or 3 days. So these are the clinical indications of calendula which I have used in my practice. This is, of course, one of the cases which I wanted to discuss with you. So yes, Dr. Patel, Dr. Avni, welcome. Okay, one case of today, I'll show you about cholesterol. Just I don't know whether you'll be able to read that, See, the cholesterol in this case was, if you can read that, cholesterol 295. Cholesterol, can you see that report? Cholesterol 295. So this was a case where the cholesterol was 295. After homeopathy treatment in 7 days, the cholesterol came to be 137. Okay. See the name of the patient. In 7 days. In 7 days. I have not taken the case of the patient in total because the patient was very, very worried about the cholesterol. As I always tell you, my clinical experience, this is not written in books. Good afternoon, Dr. Alap. Through which angle we have to reach in cases of cholesterol, in cases of CAD, in case of blood sugar. What I have told you. Yes. Which angle you have to think in this case? Anybody? So this was a very interesting case. The angle which you have to look in this case, and this was the patient who came to me after 7 days. He told me that neither the doctor is believing, nor the pathologist, even homeopathic doctor friends are also not believing. So he again checked the cholesterol today on the 9th day, and he says cholesterol today is now 140. So I told them, you first make yourself believe, the doctors believe, and then come to me rather than just telling me that how did it work. So next time I'll tell you, but remember, this is my experience, okay? Lot of cases of heart diseases, coronary artery blocks, cholesterol, I have gone to this patient through one rubric, that is grief and grief silent. It's a very, very, see, if you read the other side of grief, it is accumulation of your thoughts, accumulations of your emotions, and that accumulates in the blood, which increases the viscosity of blood and causes plugging in the arteries and veins, arteriosclerosis, atherosclerosis happens, and the cholesterol rises. This is what I have seen in my practice. So do think about this rubric. If you cannot get the case, if you feel that nothing is working for you, do think about this, and you will get very, very good results in these conditions. I hope I'm very clear. And if you see the rubrics also, if you have remedies like ignitia, natrum, neurocophia, gelsemium, pulsatilla, in these rubric where the grief is there and grief silent is there. So do think about these remedies, and I'm very sure you also prescribe this in a simple 30 potency and tell the patient to check the cholesterol after 7 days, and he'll be surprised to know that so much effective homeopathy works. Okay, so one case I had to share, so I am sharing this case with you. Of course, after a month also we'll be able to see the result. He'll again check it. He has checked it today also. That is very important, So let us go further. Any questions now? Be very fast in asking questions. If I have missed it, you can always put it again. In today's fever, there are so many cases of fever, and the only symptom is there is rawness in the throat, irritation in throat, fever, body ache. A lot of patients have this symptom. And believe me, most of them I have been able to treat only with homeopathy, though the COVID report is positive. Only homeopathy medicine, in 2 days the patient is coming out. Good afternoon, Dr. Sajdev. Laughs in sleep. I think I told you last time, okay, Dr. Meera. Laughs in sleep, that it depends basically on who is the patient, that is important. You can think about remedies like agaricus muscaris, you can think about hyosamus, you can think about tarantula. These remedies have a typical indication the patient laughs in sleeps. Of course, there are some specific remedies also that if you see the Mater Medica, it is beautifully written. When the patient laughs in sleep, 3 remedies, Dr. Meera, you have to be very, very well read about. First is hyosamus, second is lycopodium, third is stramonium. These remedies are very, very important in our case. Now I'll tell you one case. I think last time only I told you about that. I think I've told you about that case. So these 3 remedies are very, very important, Dr. Meera. Laughs in sleeps, lycopodium, stramonium, hyosamus. Causticum is also there, but I have not used causticum so frequently in my practice. Okay. Now cases of myopia. Now let me be very frank. I have cases of myopia. They are under treatment. They are much better. The number is slightly reduced, but not totally cured. Okay. And of course, in myopia, I have used remedies like I can tell the experience of remedies which I've used physostigma, gelsemium, tuberculinum, and sepia. Those are the basic remedies which I use in my practice. And if there is a problem in the optic nerve, there's a problem in the optic nerve, I normally use one remedy which is very frequent, that is phosphorus. And the problem in optic nerve is because of continuous use of social media or continuous use screen time, night and day and night. Then I use Naxomic and Strychnum nitricum. A very, very interesting remedy, Strychnum nitricum. Do use in your practice, you will get good results. Okay. Good afternoon, Dr. Sajdev. Okay, Meera, I hope you got that. Next question. In eye condition, normally what happens in today's world, because of lot of use of mobiles and of course because of online classes, people are using a lot of laptops, and this lot of screen time is increasing, and the children basically are now addicted to screen in spite in the class also. So in these cases, it's very important to understand that the screen time is too much, and that's strychnum nitricum. Of course, let me be very frank that strychnum nitricum I have used very, very sparingly, and basically what happens in strychnum nitricum, very close to what do you call strychnum phos. In strychnum nitricum, it is seen that there is lot of nervous weakness. And second thing in strychnum nitricum is the patient of strychnum nitricum becomes absolutely, sometimes a feeling of worthlessness is there. He feels that he cannot perform. He feels that he is not good in this. He is not good in that. He cannot do this. He cannot do that. So he feels why I am born. And those patients I have seen, they go in lot of addictions. They have a lot of desires for alcohol, and they eat a lot of food, and that's why suffer from delirious tremors, as it is mentioned in Mater Medica, mania potu. But it starts from being worthlessness. This symptom is important in strychnum phos. And that's why strychnum nitricum. And that's why strychnum nitricum is a very interesting remedy, where it removes the craving for alcohol. That is important. And if you study strychnum nitricum, it will give you better results than I have seen in quericus, which is used for removing the tendency to drink alcohol. Retinitis pigmentosa, I have 3 patients, and all the 3 patients are better. Means they can see some white light, they can walk, and they will come in my clinic. Of course, it's a genetic disorder, so do ask the nature of parents and the differentiating feature of parents and in the patient. In these 3 patients, I have given into 2 cases syphilinum, because there was strong history of cancer in the family. And I've seen strong history of cancer in family leading to retina pigmentosa or a destructive tendency apart from cancer. In those cases, syphilinum works better than carcinosin. Okay, I hope you are. Whenever I have good results in that case, I'll tell the patient to come and give the testimony. Okay. Hypothyroidism entry point in female after menopause. See, hypothyroidism, as the name suggests, there is hypofunction. When there is a hypofunction, that means you have already used that body part too much. Now it is exhausted, and because of that, it is hypoinfunction. That means the metabolic rate is slowed down. As I always tell you, ask the patient, how did the metabolism slow down? Here, the thinking process, the thought process. A lady marries and goes to husband's house, and there's a lot of problem. She cannot adjust, she cannot do that, wanted to do this, wanted to do that. There's a lot of dominance, there's a lot of will, there's contradiction of will, because she does not want to do this. Thoughts keep coming in her mind, intrude one another. They're disagreeable thoughts, disconnected thoughts. She just absolutely in chaos, just living in the morning, getting up, doing a lot of work, but no respite. In those cases, hypothyroidism occurs more rather than in a normal person. So entry point is you have to look out where did the metabolism go hypo. So look out for the hyper part of it. Okay. Cases of blood cancer. Case of blood cancer, I can't tell you the remedy as such basically. But if there's severe pain in the leg and blood cancer, one of the remedies, that I've used in my practice. You must always remember one thing in blood cancer, if there is a lot of pain, and it's an advanced stage, do think about some remedies like Huang Nang, cadmium sulf. These are of course rare remedies. Cadmium sulf, Huang Nang, and belly spur. Very, very interesting remedy, belly spur. And if there is a hereditary history of cancer apart from carcinosin, do think about sacrum alb, the medicine prepared from sugarcane. You understand that. So these are very, very interesting remedies, and you have to see this. In case of blood cancer, what I have seen in my practice, do use the remedy X-ray. X-ray will give you very good results when there is a lot of pain and all. Second is natrum ars. And third remedy, again a rare remedy which I use for pain, is Arenia didana and carbon sulf. So remember these remedies. This has given me a lot of good results. Of course, when I'm telling you some case of cancer, I'll definitely elaborate on these remedies. But Arenia didana, I think I have told you. Carbon sulf, I have told you. Natrum ars, I have told you. X-ray is something which I have seen that it has given me good results, especially pain, and the person is exposed to a lot of X-ray, sonography, and a lot of these ultraviolet rays. X-ray works very better. So can you please tell us about your experience with X-ray, especially can't sleep from his own heart sound? Oh, I was just telling something about X-ray. See, in X-ray, of course, whenever these type of symptoms comes, that the heartbeat of the patient is not able to sleep and all. Okay, these are very important symptom, but these symptom will not be able to cure your complaints. In X-ray, it is very, very important to understand. Of course, if you see X-ray in pathology or X-ray in the symptoms of in Mater Medica, it is written in bold letters that X-ray, when exposure to X-ray, it produces skin lesions. But now this symptom is very important. In X-ray, because of lot of exposure, it gives rise to sterility, atrophy of the ovaries and the testicles. I'll come to you. And changes that takes place in the blood lymphatics and the bone marrows. That's why given for anemia and leukemia, you will have a lot of cases of anemia in today's world, and there's no cause, there is no bleeding, there is no piles, there is no hemorrhage, but still anemia. In those cases, look at the exposure of the patient to different X-rays, and X-ray simple 30 potency will give you good results. X-ray, it is written that the distressing pain of cancer is a very, very interesting modality and symptom of X-ray. I hope you understand what I'm telling you. Do use this remedy. I have not used X-ray whenever there is sound of heartbeat is disturbing. There are a lot of remedies, but that sort of pinpoint symptom of X-ray. That's why I have not used that remedy in those conditions. But distressing pain, atrophy of ovaries, atrophy of the testicles, sterility, anemia, leukemia, these cases you will find a lot of good indications of X-ray. In fact, case of psoriasis also you will see in these cases it will work good. Exposure is important. Okay, and in X-ray, remember one thing: the nails of the patients are thickened. Nails of the patients are thickened. Skin is cracked, wrinkled skin, and dry eczema. Now, whenever you have the nails are very thick, which remedy I have told you? You have to think about that. Which remedy I have told you to think about that? Dr. Kocher, welcome. 30 potency X-ray. Whenever the nails are thick, and suppose the remedy which I have told you, calcarea silicata, very good, Dr. Palak. If it fails, then I use X-ray. This is my clinical experience, not written in books. Whenever the nails are thick and calcarea silicata maybe it does not work properly, I use X-ray and it works wonderfully. Because if you see calcarea silicata also given for warts, X-ray is also given for warts. Calcarea silicata also has dry skin and cracked skin. X-ray also has the same thing. Itching is there, eczema is there, X-ray also, and calcarea silicata also. Very, very close. Okay. So this is clinical experience. Antim crude and thuja. Okay, good. Yes. So can we go further? Antim crude thuja warts. Yes, antim crude thuja is a good remedy for warts, and we have discussed this in detail. So I think you all know something about antim crude and all. Can we go further? Thuja warts, very, very common remedy. I think everybody from, first year studies thuja for wart, and it's such a wonderful remedy for warts, Antim crude also very interesting remedy, and antim crude, if there are no questions, I'll just think about, show you something about antim crude, Antim crude, if you understand, if you are prescribing on the constitution, which constitution requires antim crude? Anybody? Which constitution requires antim crude? Anybody? Yes, anybody? Antim crude. See, in homeopathy, it is very important, the ways of prescription through constitution. Antim crude is a remedy, thick, obese, and fleshy. Okay. Anything else? Remember one thing about antim crude. Now, basically, we are talking about the mater medica, which is clinical. See, leukophlegmatic, it is very good to define, but how will you see in the patient? That is so important. So, antim crude, remember, children and young people who are inclined to grow fat. So, suddenly, a patient comes and tells you, my daughter was just in 9th class, she was very, very lean, thin, suddenly she has grown fat. Antim crude type personalities. Inclined to grow fat. Compare antim crude with calcarea carb. Or for extremes of life, very young and very old. That is antim crude. Now, this is clinical. Leukophlegmatic is good, fleshy is good, but now interpretation of fleshy for everybody would be certain different. So we have to be very sure. Irritability. Irritability is there in antimony. But what irritability? Like it is written in antim crude, all people who have morning diarrhea suddenly become constipated. Or there is alternate diarrhea and constipation. And whenever there is alternate diarrhea and constipation, in which disease you can think about antim crude? Anybody? See, now I'll tell you something more about mater medica. Okay. Everything is there. Now, how to repeat the medicine in blood cancer? Yeah, so I'll just keep it at anthem crude. Normally, what happens, I start with 30 potency if I'm using a very acute remedy twice a day for at least 3 days and then see the result. If the patient is better, I stop it. If it is not better, then I shift to LM potency, then twice a day. Continue still is better than once a day, then once alternate days, and gradually then I taper it off. This is how I use in cancer. And if you have LM potency, it is much better because you have to repeat, because I repeat in cancer because it requires repetition that I've seen in my practice. So anti-crude, anybody? Alternate diarrhea and constipation. Have you ever seen these type of symptoms, and have you ever given anti-crude in this symptom? And this supposed to be the very important and three marking symptom of anti-crude. But have you ever given anti-crude in this symptom? Yes, anybody? If BP is controlled by Ralphia Q, then it is necessary to give constant medicine, as there is no such symptom complaint related to BP. For how much during Alpha Q after BP is no. Yeah, if basically if Ralphia Q is able to control the blood pressure, that means it is basically the mother tincture. So it is having a physiological action. So at least you have controlled the blood pressure of the patient. But now you have to understand why the BP went out of control. No? Why did the pressure in the blood went out of control? And for that, what is the definition of blood pressure? It is the peripheral pressure applied by the blood on the arteries. So see in which condition the pressure has increased related to mind. And then if you give a constitutional medicine, of course, there's no need to repeat Ralphia. So you can always put Ralphia in acute condition where the patient's blood pressure is very high. It is going 180, 120 or malignant blood pressure. And with Ralphia, it comes down. So you get some breathing time. Ask some patient the why. Why did the pressure increase? And if you get the answer, prescribe a medicine. And there's no need for the Ralphia to work. And keep as a buffer Ralphia. Okay. Keep as a buffer Ralphia and tell the patient that whenever you are stressed, whenever you feel the BP is increasing, and if I'm not there, you can take Ralphia Q. Okay. RR high Nach eclampsia in pregnancy. No, I did not get the question, Dr. Weber. RR means what? Blood pressure in pregnancy. Okay, eclampsia. Okay, fine. So now, again, a very, very important condition, blood pressure condition during pregnancy. And in nowadays, you have problems of thyroid, problems of blood pressure, and problems of sugar during pregnancy, And what happens in most of the cases, they say, okay, it started from pregnancy and now it is for life. So it is very important at the time of pregnancy to control these conditions so that it does not stay for life. Now why does it increase in pregnancy? Whenever the body is exposed to a trauma or exposed to a condition which requires lot of a lot of stress to be thought of, means the body has to face a challenge, and that constitution is not able to face that the extra challenge that the body has, and it goes out of control. Maybe it is hypothyroidism or hypo, it is blood pressure or diabetes. In this condition, if you're asking only blood pressure, some remedies, of course, for me, I used to before prescribe only in that condition of BP, but now I see why did the pressure did not go, why did the pressure increase. So you have to think about the patient constitution in SORA, then what happens during the psychosis, and now after pregnancy, after marriage, what happened in the family, that is important. So in this condition, the few remedies which are very, very useful, first remedy, the three marking remedy that you should always remember is Veratrum viridi, not alb. Veratrum viridi. Some patients are very much excited, they're very happy, excited. In those conditions, also the pressure goes up. The remedy becomes semesifuga. Sometimes what happens, the patient, there's a lot of mental trauma and the patient becomes very irritable and very, very hyper because of the trauma, because of this family situation. The remedy becomes Kali Brome. Last time I talked something about Kali Brome. I hope you remember. Apart from that, the patient itself is an angry constitution. He is not able to handle that stress and he becomes very violent because he has a innate constitution. Then the remedy comes hyoscyamus. These are the cases where other remedies which are used. So hyoscyamus, Viratrem viridi, Calibrom, Semicifuga. If it is because of blood loss, China, sickle core, Ignitia, lot of remedies. That's how I prescribe in eclampsia. Irritable bowel syndrome, Dr. Sachdeva, very right and very, very good answer. I hope you use in irritable bowel syndrome and it will give you very, very good results. It's such an important symptom of anti-crude alternate constipation and diarrhea, but I have seen doctors hardly use that symptom for this type of disease because IBS is a very, very tricky disease to treat, very, very difficult disease to treat. And because of the problem in the peristalsis, they have alternate constipation and diarrhea. Okay, so very well answered. Pimples flat, not cystic or pustular, but black discoloration left. See, whenever if you get a case of pimple, whenever you get a case of pimples, it is always black in color. So what happens, maximum times we basically are inclined to prescribe those remedies which are very, very common, And I remember that when in early days of practice, we had been taught that whenever there is pimple, black discoloration, always give Calibrom. And of course, you give Calibrom and the patient is better, good. If the patient is not better, you can keep changing the remedies. But blackish type, apart from Calibrom, think about 3-4 remedies, very, very important. Dr. Joshi. Arsenic album, a very, very interesting remedy, blackish in color. Second remedy, you do remember, it is Spigelia. Very, very interesting remedy. And if it is a lady and the same symptoms are there, do think about graphitis, Berberis acufolium, and pulsatilla. Very, very interesting remedies, and you will get very, very good results, नेक्स्ट वी हैव सर मुझे डेंगू हुआ था उसके बाद से काफी बाल झाड़ रहे हैं. ओके, अगर डेंगू हुआ था और बाल जा रहे हैं, सो एक बहुत अच्छा रूब्रिक है फाटक रेपिटरी में, नेवर वेल सिंस द acute disease. You go and see that rubric. And बहुत कॉमन प्रैक्टिस है कि जब भी कोई बुखार आता है, चाहे हमको टाइफाइड हो, जॉन्डिस हो, मलेरिया हो, डेंगू हो, तो एक डोज कार्बोवेज का देना चाहिए. सो ये कार्बोवेज है, एंटीमक्रूड है, सोराइनम है, बट एक बार एक डोज कार्बोवेज का देखिए आपको उससे फर्क पड़ जाना चाहिए. सर, मेन सिम्टम ऑफ पेशेंट एज सून एज ही गोज टू स्लीप वेक्स अप विद अ जर्क ऑफ ब्लैक, हाउ टू अप्रोच. नाउ सी, एक बार हमने इसको डिस्कस किया था कि व्हेनेवर देयर इज जर्क, और एक बहुत इंपॉर्टेंट सिम्टम है, और अगर पेशेंट ने अगर बोला है ना तो बहुत इंपॉर्टेंट है वो, जस्ट रूल आउट वन थिंग कि भाई पेशेंट को कुछ सेरेब्रल डिजीज तो नहीं है, ब्रेन की बीमारी, उसमें जर्किंग काफी दिया गया है. और क्या होगा, अगर आपको जर्क मिलेगा ना तो आप हमेशा एक रेमेडी हमेशा दिमाग में आती है, जिंकम मेटालिका. बट अगर आपको जर्क मिलता है और पेशेंट सडनली उठ जाता है जर्क की वजह से, एक रेमेडी आपको हमेशा सोचना है, एंड दैट इज बेलेडोना. और अगर बेलेडोना का पैथोलॉजी सोचेंगे तो बेलेडोना का एक्शन होता है ब्रेन पे, इसलिए आपको ये रूल आउट करना है कोई ब्रेन कॉज है क्या. सो बेलेडोना है, कैनबिस इंडिका है. एक रेमेडी मैंने बहुत मेरे प्रैक्टिस में यूज की है, एंड ऐसा नहीं कि बिकॉज ऑफ वो इरिटेबल लेग है, रेस्टलेस लेग सिंड्रोम है, इसलिए जिंकम तो नहीं, आई हैव नॉट गिवन. मैंने बहुत देखा है केसेस के अंदर इग्निशिया, रस्टॉक्स एंड कालिकार बहुत अच्छी काम करती है. बट यू हैव टू डिफ्रेंशिएट, अगर ब्रेन डिजीज की वजह से है तो देन आपको रेमेडी सोचना पड़ेगा, जिंकम मेटालिकम और बेलोडोना. बेलोडोना बहुत मस्त काम करती है केसेस के अंदर. बट सिर्फ एक सिम्टम में मैं शायद वो ड्रग नहीं दूंगा, बट इसलिए आपने पूछा क्वेश्चन, इसमें आंसर कर रहा हूं आपको. Patients having symptoms of rust talk, severe pain in the legs, very restless at night, in blood cancer. Oh, so see, what happens if the patient is of rust talks, severe pain in the legs, very restless at night? Do think about 2 or 3 remedies. The first remedy you should think about is Nux vomica. Nux vomica. The second remedy you think about is Echinacea angustifolia. ये 2 रेमेडीज बहुत इंपॉर्टेंट है. और थर्ड रेमेडी अगर आप देखेंगे, थर्ड रेमेडी ये भी बहुत इंपॉर्टेंट है, बट आई डोंट नो आपने यूज किया है प्रैक्टिस में कि नहीं किया, बट बहुत इंपॉर्टेंट रेमेडी है। अगर पेशेंट को बहुत ज़्यादा रेस्टलेसनेस है, स्पेशली एट नाइट, एंड लॉट ऑफ पेन है, एक रेमेडी आपके बहुत अच्छे काम में आएंगे, दैट इज फाइटोलेका। एंड एक रेमेडी, अगर आपको कुछ भी नहीं समझ में आ रहा केस के अंदर, प्लीज राइट डाउन द रेमेडी। बहुत ही इंटरेस्टिंग रेमेडी है, मेरे को ऐसे बहुत बार हुआ है। डॉक्टर सचदेव, आई हैव यूज्ड कुरकुमीन, that is haldi, turmeric. It has given me very very good results. Curcumin, remember this remedy. So ये सब रेमेडीज है जो आपको हमेशा सोचना चाहिए विथ रेस्टलेसनेस। मैं कहूंगा कि अगर कुछ भी सिम्टम, नीचे से फर्क नहीं है, नक्शों से फर्क नहीं है, और आपको सिम्टम कुछ भी नहीं मिल रहा है, डू थिंक अबाउट कुरकुमीन। इट इज़ अ वेरी वेरी एंड अ वेरी वेरी इंटरेस्टिंग रेमेडी, और मुझे रेमेडी ने बहुत अच्छे रिजल्ट्स दिए, कुरकुमीन। Thank you. Sir, if person has anxiety and having anxiety from fear of disease, pressure 140/90, but anxiety is gone, BP 1.80, what kind of remedy? See, मैं एक चीज बताना चाहूंगा आपको कि ये एंशियस पर्सनैलिटी नो, ये आप बहुत बार देखें। अब जैसे नए नए प्रैक्टिस में आते हैं ना, तो अपने को हर अभी बीमारी के अंदर किसी को एंशियसनेस डेवलप क्यों होता है, एक तो उसके पास्ट हिस्ट्री में कुछ ना कुछ बीमारी हुई होंगी, फर्स्ट। सेकेंड, उसके फैमिली में किसको बहुत बड़ी बीमारी हुई होंगी। थर्ड, उसके फ्रेंड सर्कल में, विसिनिटी में किसको बीमारी हुई होंगी, और somebody having disease. So he has that fear and he carries that fear in everything what he gets. If he gets palpitations, he feels that इसको heart disease तो नहीं है. If he gets something, he has a typical fear of disease. So try to find out what is the cause of anxiety, and when does the anxiety return, in the morning, evening, night. Because if you see the rubric anxiety for disease, this is my experience, okay, this is telling for, if you have seen anxiety of disease, there are remedies where the patient has symptom of anxiety of disease, but I have given these remedies in my practice, and it has definitely not given me so results, anxiety of disease, because I feel that is a very common disease, that's a very common symptom, and if you take that symptom for prescription, you may sometime get results, and sometimes you may not get results also. So try to find out the cause of anxiety. And if you can get the cause of anxiety, then you will be able to crack that case very easily, and you'll be able to taper his anxiety so that in future, because of that anxiety, he does not suffer from other effects of anxiety on the body. Okay. Pimples with multiple whiteheads only around the nose. Yeah, so it is, see, now it is very nice, you are actually having a what you call nose part and nose acne in the nose. Now if you have, I think, joined my Google Meet, when I told you nose represents what in the body? Nose represents what in the body? Nose has a representation. What is the importance of nose? Psychologically, we can say. Anybody? If ego, yes. So it's very nice. It's an ego problem. So मतलब आपके नाक पे somebody sitting on your nose, and then you have this esteem. Very nice, very nice. So I'm very happy that people are basically following that. Whenever there is an esteem problem, the nose gets bad. In the same way, you have forehead, chin, cheeks, everywhere. No? Yes, everybody's right. So if you have eruptions or acne on the nose, do think about one remedy that is very, very important. Very, very important. And the remedy is arsenic album. I have got very good, very fantastic results when the acnes are only on the nose. Second remedy that you should think about in case of nose, think about Viratram, think about sulfur, and lastly, think about fluoric acid. But one remedy that is very important, you should not miss out, is arsenic album. Very nice. So, very nice. Can we have few more good questions? Good questions. So everybody learns from this question. I posted a case, I don't know whether you have got the case or not, that there was a case of migraine, migraine. And the patient had a problem that whenever there was a migraine, he had taken a lot of medicines. He used to always do like this during migraine. And whenever the patient started doing like this, the family member knew that now he'll get an headache. Such was the more so he had taken homeopathy and a lot of medicines for worms and all, nothing worked. But he came to me and I prescribed just one dose of that medicine in 200 potency. Which is that remedy? I think I've posted that case. I don't know whether I've posted in groups. There are so many groups, so I also get confused and all. Which remedy comes to your mind? Don't think about Senna. Don't think about Santonine. Don't think about Chilone. Don't think about Teucrium marum verum. Just because there is boring of nose in headache. Which remedy? It's a very, very commonly used remedy and a very, very interesting, striking symptom of that patient. Boring the nose with headache. No, not aurum triphyllum. Not aurum. I think I must have not posted the case. The remedy which I prescribed, you know what was there? I'll come back to the juice, but let us first discuss the remedy. I gave that simple remedy, Hiparsulf. Yes, Hiparsulf. Hiparsulf. Hiparsulf is a very, very interesting remedy. Don't always think about Hiparsulf only on respiratory tracts. I have put my YouTube videos on Hiparsulf respiratory tract part 1 and part 2, and people have loved it and all. But this is a very common indication of Hiparsulf. But there are some indications of some chronic remedies having a very peculiar symptom, and one of the peculiar symptom of Hiparsulf in migraine is boring the fingers in headache. Single dose Hiparsulf 200 was able to treat that case for years duration. That is Hiparsulf. Large cystic. Now, if you have cystic of both the ears, you can always start thinking first of Ledampal, then of Staph aureus, Calcarea flor, Iodum, and Kali iod. Okay. Kali self, no, not Kali self. Vikas Agal, sir, I am working in space research department sometime with very stressed life and less sleep. Makes headache on top and heavy congestion if happy. No constipation. I have a lot of homeopathic treatment. Okay. So anybody, it's a very, very common activity these days. Even doctors also, we are working day and night because of the rush and the OPD. Then it's a very, very common problem that you have sleeplessness problem and you have stress problem, and your body basically gives out. No, you have the body basically gives out. So what remedy you should think about in the first place? Anybody? The first remedy, I think everybody basically must have used this remedy somewhat in their practice, and I have been telling you this remedy, I don't know, so many times I've quoted this symptom of that remedy, that this remedy is such a wonderful remedy. Bad effects of stimulants and coffee and sedentary habits and long continued mental worry, overexertion. Which remedy comes to your mind? A simple remedy, Nux vomica. You read Nux vomica from Allen's keynote, I've quoted this: bad effects of long continued mental stress, overexertion, yes, sedentary habits, loss of sleep. Everything is covered in Nux vomica. And do then compare Nux vomica with few remedies which are very, very, again, very close. Yes, very close. And what is that? Nitric acid, colchicum. And one remedy I have always told you, always compare that with Nux vomica. Those remedies go very close. Nitric acid, colchicum, and one remedy that I have used sometimes more than Nux vomica. Which is that remedy? Anybody? Anybody? Let us first finish that. You will get this in doctors, CS, chartered account, anyway, a lot of professionals, And that remedy is not picric. Picric acid has something very different, No, not arsenic. Picric acid is a classical remedy because of lot of literary work. Reading, businessmen, teachers, scholars. Picric acid. Now this remedy, I told you, wicked disposition. Which is that remedy? It is written in bold letters, bad effects of lot of sleep. No, yeah, Naxomic is there. Bad effects from loss of sleep, mental excitement, night watching, after loss of sleep, anger, grief, exactly like Naxomica, but not Naxomica, not phosphorus. You have to improve your Matremedica. This is the other side of Matremedica. Normally you start understanding Matremedica, summary of drugs and the theme of drug and XYZ, but you then forget the very, very important indications of those remedy. Not acid phos, not lycopodium, not caliphos, not caliphos, not leccan. It is a very, very interesting remedy. In fact, I had given that remedy for a lot of students who are appearing for NEET, appearing for NEET, studying 18, 20 hours in a day, loss of sleep, loss of stress. And then that remedy worked wonderfully. Not ruta, not acid phos, not caliphos, not leccan, not lycopodium, not phosphorus. Any other guesses? That remedy, wicked disposition, that not ignitia, not bryonia, not picric acid. See, homeopathy, Matremedica is so close. That's why I always tell you, learn something more behind what is there in Matremedica to get good results, And that's a simple, in fact, it is written in bold, bolder than Naxomica, and not Gilsemium. The remedy is Cocculus indicus. If you have Allen's keynote in front of you, please open Allen's keynote. Anybody, if you have Allen's keynote in front of you. And it is written, you go down, I don't know the line number, you go down and see bad effects. It is written in bold, loss of sleep. If anybody can see in Cocculus indicus. Cocculus is a very, very interesting and important remedy at par with Naxomica, loss of sleep. Go and check Allen's keynote. Of course, it is giving a lot of remedies, but Allen's keynote. Don't always think that nausea and vomiting from riding in a carriage or boat or railroad. Okay, it is there. But this is more indicated of Cocculus. No, Cocculus indicus. The remedy is Cocculus indicus. Go and read Allen if anybody has Allen's keynote. It is beautifully written in Allen's keynote, adapted to bookworms. किताब में जैसे लिखा है, हाँ इसमें है, इसमें it is bookworm remedy. Romantic girls with irregular menstruation, after night watching, that is Cocculus indicus. And loss of sleep also, loss of sleep. Do check Allen's keynote. See, we all learn together then. So don't forget Cocculus indicus. Very, very. Everybody remembers the vertigo of Cocculus. But do remember this loss of sleep and excitement and night watching of Cocculus, which has given me so many results. One dose of Cocculus and everything comes back to normal. And write down in your head and your Matremedica in your notes. Whenever an acute complaints come to you, make sure that you take the acute case properly. Of late, I have seen, in case of corona or in case of fever, that acute remedy becomes the chronic remedy of the patient, or the remedy is around that patient. The remedy of the chronic is around that remedy. So acute complaints basically come to teach us that you have missed the consultant remedy. So again, I am coming back to you. Find out some acute remedy, and in that acute remedy, the consultant remedy is hidden of the patient. Write down these wordings. So take every acute disease very seriously, and the chronic remedy is actually hidden in that only. In my family, I've seen my children's, my wife, everybody. So I've seen those cases in my life. Okay. So let us go further. Naxomic, we have already told. I've already told the remedy. Okay. So let us go further. I hope you understood about something Cocculus, Let us go further. Don't get lost in Matremedica, because it has a lot of other symptoms, beautiful symptoms, some rare symptoms also. Because in the end, it only matters that how are you able to cure a case or treat a case in your OPD. How to get the remedy, that is important. Let us go further. Yeah, thank you so much. So whenever you get results with cocculus indicus with this symptom, do write to me or do write in a YouTube or on my WhatsApp. So I know that you are understanding what I want to share with you. Okay. Don't always look for the rubric elements from debauchery and then you start remedies like Naxonica, picric acid, all. Because elements from debauchery, if you've seen, cocculus indicus is not written. Cocculus indicus is not written in elements from debauchery. So why Orometallicum? We are through with the answer. Don't get the repertory. We are through with the cocculus indicus. Go home and read cocculus indicus, Allen's keynote. Very easy symptom, very easy to remember. Let us quickly have some other questions. One or two questions before I close off. I have one webinar at 4:15. So let us have only one or two questions before we close off the session. Anybody? या अर्जेंट नाइट्रिकम, चामोमेला, ये सब है, बट हमने कॉकुलस बता दिया है लॉस ऑफ स्लीप से भी। आप आगे बढ़ते हैं डॉक्टर हुसैन। अभी हम एक आधे क्वेश्चन देखते हैं, एक दो क्वेश्चन फिर बंद करेंगे। मेरा वेबिनार है 4:15 बजे। Yes, anybody? One question and then we can move on. Yeah, Meera is Zorum Metallicum. Swapnil, thank you. Thank you, everybody. So let us have one more questions, or I think all questions are answered for today. Sometimes go beyond repertory, sometimes go beyond Matermedica and understand the patient first, Repertory, rubrications are so close. इतने close rubrics है कि हमको differentiate करने के लिए बहुत तकलीफ होती है. I'm telling you very frankly, once the patient is cured, then you can answer all the questions of that remedy. Okay, I saw this. But till it is cured, the rubrication is also very difficult. What to take element from deception or disappointment or chagrin or mortification. It is such a difficult thing sometimes. So after a cure, everybody can present a beautiful case of Matermedica. But then how to get into that remedy, it's an important thing. So we have a question. Pain in knees and it feels when person gets up or sits, feeling good with warm in that knee. Rustox is correct. See, a feeling of warmth, see, if you are prescribing symptomatically for case of arthritis or for case of knee problem, you will be surprised to know that most of the cases Rustox will cover. And you will prescribe Rustox, but sometimes it does not cure. It only relieves, does not cure. So better by warm, there are a lot of remedies, and sometimes you feel it's a common symptom also. Dr. Chatterjee, you can think about Rustox, of course it is there. You can think about Maxphos, you can think about Lycopodium, you can think about arsenic. बहुत important है ये. कुछ पेशेंट आपको आके बोलेंगे कि मैं जब गर्म पानी लगाता हूँ ना, जो हॉट वाटर बैग रहती है ना, जो बैग रहती है रबड़ की बैग, और लगा के अच्छा लगता है, बहुत एजेड लोग आपको बोलेंगे कि जब भी मैं रबड़ की बैग लगाता हूँ ना, सेकता हूँ ना, मुझे बहुत पसंद आता है. सी, रस्टॉक्स है, लेकिन एक बहुत रेयर रेमेडी है डॉक्टर चैटर्जी. वन रेयर रेमेडी इज देयर एंड दैट इज मेड्रागोरा ऑफिशिनरम. सेकंड इज कोलोसिंथ, देन नक्सोमिक एंड द रस्टॉक्स. So better by cold warmth application, better by warmth. ये सब अलग अलग symptoms है, तो Rustox तो आएगा ही सबके अंदर. What we do when there is not found the peculiarity? Okay, see, if you have not found the peculiarity in the case, मतलब अगर आपको, if you have not got the symptom from the patient, try to find out some symptom from the patient's constitution. उसके बाल कैसे है, उसकी आंखें कैसी है, उसके होठ कैसे है, उसकी नाक कैसी है. हम जब भी लड़के लड़की का जब अफेयर होता है तो लड़का देखता है जिसके बाल कितने अच्छे, उसके आंख कितनी अच्छी है, लड़की देखती है उसके कितना हैंडसम है, उसके बाइसेप्स कितने अच्छे, उसके स्किन कितनी अच्छी है. ये अच्छी है, इट इज गुड बिकॉज इट इज समथिंग वेरी डिफरेंट फ्रॉम अदर्स, नो. सो यू कैन सी दैट एंड एंटर द केस. स्किन रफ, नोज पॉइंटेड, नोज नॉबी, eyes glowing, eyes dull, hairs lusterless, hairs dry, chin tapering, chin broad. See, you can see Mater Medica from anything and you can get to the remedy. Try to develop that habit of seeing what the in front of you, and you will definitely be able to crack the case. Okay, so don't worry. Calcarea cap constitution, cold with draft of air, sleeps with mouth open, laryngitis with better by vasodilating effect. Okay. Now, what is the question? What is the question? See, okay, you now see cracking in joints. Of course, there are lots many of cases that are cracking in joints. There are few remedies which have helped me in my practice years back. Please write down. First remedy is Rustox. Second remedy is Ledum Pal. Third remedy is nitric acid. Fourth remedy which I have used is Calcarea carb. Of course, benzoic acid also. Psoriasis of both hands better by washing in cold water. You can think about Ledum Pal, petroleum, Anthracocali, Chrysobium. But don't prescribe on that symptom, because only symptom will be better. The patient will be back to square one after some time. Take the whole case. Bharti. Thank you, sir, for giving us idea about the unique medicines of common. Yeah. In fact, before I close today, I think we have. Can anybody tell me something about Calcarea carb? Something very unique symptom of Calcarea carb that everybody must remember. Please tell me something about Calcarea carb. Anybody? Which had told you, do remember that, because ये symptom आपके बहुत काम में आने वाला. Anybody Calcarea carb? Can anybody tell me some very important symptom of Calcarea carb, which I told you, I think few days back, I think in the last webinar? Which is that? Before I close, let me ask you one question. Longing for fresh air. Yes. Longing for fresh air. A very longing for fresh air. Can you go further deeper? What is the meaning of that and how to remember that? That is important. Yes, desire and is better in fresh air. And what does the fresh air do? It strengthens, inspires, and that is important. It strengthens, inspires, and benefits. That is Calcarea carb. Not open air, it is fresh air. Longing for fresh air, which inspires, benefits, and strengthens. That is Calcarea carb. Do remember, everybody, this is a very important symptom of Calcarea carb. So with this note, let me finish this YouTube. 1 hour has passed very fast. Thank you, everybody. Thank you for your time, and keep seeing my YouTube videos. I'll be uploading some clinical experiences of the recently used remedies today. Thank you so much. Thank you very much.